Hello, and thank you for joining us. I'm Emily Figgins, the Public Information Officer for Marion County. The video you are about to view is just one part of a multi-part series that I have put together in collaboration with the Marion County Board of Supervisors, the publicly elected officials of Marion County, as well as the department heads of the non-elected offices of the Marion County government. This series of videos is designed to provide you, the taxpayer, with information on how the Marion County government utilizes your tax dollars to provide the many services that are available. Thank you again for joining us, and please watch the channel for future videos.
Good morning. I'm here with Kim Dorn, Director of Marion County Public Health. I'm Mark Raymie, Chairman of the Marion County Board of Supervisors. We wanted to give you an update this morning on changes that are occurring within Marion County Public Health. I'm sure many of you have heard various pieces of information about what's been going on there. We've actually shared this in a couple of board meetings, but I thought it would be good to put together a short video with Kim to go through why did the changes occur, and then where do we stand currently as a result of those changes. So Kim, thanks for joining me this morning. And I know you've been going through a lot with restructuring and what the state has mandated. So Kim, how did this all start with, we've got our public health department, we've been functioning a certain way for decades, administering programs that are predominantly funded from the federal government or the state, and now those programs are gone. So what happened? What caused those programs to go to a different entity?
Well, we do a competitive bid every 5 years. So every 5 years, and I don't think people know this, that every 5 years we actually compete for WIC, maternal and child health, and those other associated services. So we have provided WIC services since the, since the mid-90s. And we were a subcontractor for maternal and child health into the 80s, and then in the early 90s we became a contractor for maternal and child health. So we've got a long history of providing those services, and they generally all went well. We didn't have any reason to be concerned. Our program audits, our financial audits were all clean the whole time. The state has just decided to change things up, and they put us in a different service area, and we competed with a group out of Ottumwa that has been also a very long-standing provider of WIC and maternal and child health services. So the new service area is more in their service area than what was traditionally our service area.
Okay, so probably one key point initially, so that everybody understands, is that Marion County, we were shifted from the area we normally have served historically and put into a different area that it basically drove the competitive issue.
Right.
Had we been in our area that we've served for many years, then we would have been the only entity in that area really bidding for these services. Is that a fair statement?
Well, they changed the other side of the service area too, but yeah, I mean, we would have probably retained the services.
Okay. So we had to compete with this other entity out of Ottumwa, American Home Finding Association, a nonprofit down in that area. They've been doing this for a while as well.
Right.
And American Home Finding, they received the grants to do which services?
WIC and maternal health and child health services. And so there will be some additional competitive issues, because we also have First Five, which they delinked from child health, but then they extended our contract through December now. So I think they will probably move that back into the competitive process again here. We'll provide that through December.
Okay. So from what the changes that have occurred so far, where do we stand within our own public health department. This has obviously had a material change to staff.
It does.
So a rough estimate, how many positions are we talking about losing as a result of these changes?
Well, we've had several people already move on. So you know, they see as this process has gone, they've kind of understood, oh, that means I need to be looking for something. So we probably will lose about 3/4 of our staff.
Okay. And I want to reiterate so that the viewer knows, again, the funding for these programs came from the grantee, which would be for the federal government in this case.
Right.
And without that funding, we can't support those services. We don't have the capacity to support the salaries.
Right.
We don't get any overhead cost reimbursement that we used to help fund the program, provide benefits and those things. So it's essentially taking those jobs and taking all of the funding stream associated with those jobs away, not to mention the service dollars that we had to provide the service.
Yeah.
Fair?
Yep, that's true. So American Home Findings is setting themselves up to provide WIC services and maternal and child health services in Marion County. They said in their application that they would be here twice a week in Knoxville instead of our traditional WIC day here in Knoxville has always been Wednesday. They have said they'll be here twice a week, so we'll expect that will happen. And their space, they've found space to rent in the Raceway Mall. And so that is where WIC will start happening starting the 1st of October. So it will, you know, up until the end of September, it will still be at Marion County Public Health, but the 1st of October, it starts at the Raceway Mall. And all of the participants should have gotten a letter from us saying, hey, we're not going to be the contractor starting the 1st of October. You need to contact American Home Finding about your services starting the 1st of October.
So those notices are going out right now to those individuals who were served.
Those were out at the end of last month for WIC.
Okay.
Now we're just now starting to get those notices ready to go out for maternal and child health.
Okay. So they'll be notified on where they need to go,
right?
Based on the new service provider that's going to take over these programs. I want to take a step back for a minute, Kim, just so everybody understands. The Board of Supervisors during our budget hearings, we prepared for retaining all of these programs. If you were to look at our budget going into this current fiscal year, we actually prepared for receiving all these grants,
correct,
supporting our services, supporting our staff, and still administering the programs as we've done for decades. So it's quite a material change to us as well,
right,
as we look now to see what public health will look like post all of these changes. Who's the predominant? It's not that we want to cast blame. These are administrative decisions made at the state level.
right.
But this is coming predominantly from Iowa Department of Public Health.
Yes.
So they're the ones that decide where these programs go through
Correct.
the competitive process.
Right.
Okay.
Yeah.
Okay. So I think that's important for everybody to know, that we could budget for these programs, set aside the dollars, prepare to administer the contracts, but until we get the award
Right.
from IDPH.
It's
Right.
And it's been, the process has really been the same since the 90s, because every 5 years I'd say, okay, we either have it or we have part of it, or it's a projection.
Right.
The budget is a projection.
Right.
So this year's budget was projected to have, actually more money in it because the service area was larger. And so this makes a difference of about $2.5 million in the budget that I proposed to what is probably going to happen.
Right.
So, if just because it's there doesn't mean we get to spend it.
Sure.
I know that you know that.
That's right. That's right. And
Yeah.
also, so people understand this as well, that $2.5 million variance isn't coming from Marion County taxpayers.
Right.
It was actually the way government accounting works. We count cash in, cash out. So the cash in was going to come from these grant programs. The cash out was the money from the grant programs funding the actual people and services. So from a tax standpoint, locally, it really doesn't do anything.
Correct.
Other than whatever we arrive at, what public health will look like after all of these changes. And that's something the Board of Supervisors, along with Kim, will be discussing probably over the next several months as a result of all these changes. What will public health look like locally? And Kim, I know you've had some thoughts on that and been putting some things together on that, but
Sure.
We're probably not ready to really talk about those things yet.
Not really in detail. We know that one of our focus areas will continue to be emergency preparedness and response for public health related emergencies. We'll continue with that. And then there are, of course, immunizations and of course immunization audits and those kinds of things that are
Sure.
mandated that the Board of Health be responsible for. We'll do those things. But as far as service, to the community, we're going to need to see how some things land and do some planning and figure out just kind of what are we going to look like in the future.
Okay, very good. Well, Kim, thanks for your time this morning. Appreciate the update. I know this has been quite a change for you and your staff. And again, from a Board of Supervisors standpoint, we appreciate all the employees of public health that have worked there for all these years. And regardless of the changes that have been brought about through state action, they have served our folks extremely well.
Very, very well.
Very well. And so
Very
we definitely appreciate that. Stay tuned for further developments on this topic. We'll have those in Board of Supervisor meetings and future update videos. Thank you for your time this morning.